Hi everyone, I'm here at ATTD 2025 and we have a whole team here from India led by Dr. Banshi Saboo. And it's been amazing 4 days of conference and a lot of discussions, a lot of highlights on technology and artificial intelligence that is developing in the space of diabetes management. Dr. Banshi, tell us your takeaway from the meeting, some of the highlights, and also a little about the session that you spoke about.
So first of all, I would like to thank ATTD and all the Indian colleagues who have come here. But I can tell you, before 15 years when meeting was started, those time, hardly anyone used to come from India. Slowly, in last 10 years, what I am seeing that many doctors started coming for this meeting. This shows interest is increased in our country as far as technology. Seeing this technology interest, not only they are coming as a delegate, they are presenting the paper. They are presenting their own data. And before 3 years, you know that we also started a diabetes technology meeting in our country. The idea was the same, that as the technology usage is less in our country, let us do more, and we should have more doctors in India who are using technology in their practice to improve the diabetes care. Now, regarding this 4 days amazing conference of ATTD, we really loved it. I am coming since last 10 years. Every year is a delegate started, then I was a part of faculty, part of the consensus, and today I'm the part of ATTD as an organizing committee or in scientific committee too. The ATTD this year was unique in 2-3 ways. There is a first time I have seen there is a AI, artificial intelligence based they have started. You are the AI guy from India, and that's the reason I'm asking you and telling you first thing that AI is being a separate dedicated session on that. And they also have AI-based podcast will be now released for everyone. This time our DTech Diabetes India Symposia, which we have done, and where I talked about the lifestyle modification along with continuous glucose monitoring. And I have shown some of the patients the amazing data which we had shown that, you know, how a person even without taking any medication could change the lifestyle and could get the HbA1c better. If I have money, there is a question, should I use the CGM or should I go for GLP-1? That's a very important question. You can always ask that if I have money, because India, they have to pay from their pocket. But I always feel that it's a monitoring which is more important where you are going. If you don't know where you are going, I don't think you will reach the destination. I agree that yes, the patients need the newer therapy too, and there are a lot of evidence for that. So for type 2 diabetes, still there is a debate that everyone needs, but personally, I feel that everyone, they need it. I have written a guideline or a sort of a consensus in India that we should use this CGM if they are using intermittently, not every month, or they can't afford to use it every 15 days, at least once in 3 months or once in 6 months or once in a year, depending on their clinical situation. That's what we can do for our country. But I wish that all those who are on insulin, all those who are insulin deficient, they should be on continuous glucose monitoring. Absolutely, there is no doubt about it. And possibly, if they can afford, the AID is the best system for that. The second thing which I have seen, that even those people who are on AID, still there is a lot of fluctuation. And the same thing now I started seeing after my 100 patients on AID, I also started seeing that yes, there are people who are not getting more than 75% or 80%. Why they are not getting time in range every time? Because they are skipping their bolus. They are sometimes taking direct sweet. That also leads the same way, because that's the behavior of the people that is not able to be changing. So we have to do something on the mental health, something to change their behavior. Even they are continuously monitoring, but still they keep on doing. This is also the second thing. And there are a lot of papers which has been published all over the world. And I am sure maybe in coming years, we will also able to produce such papers, because now in India, have more than 2,000 patients who are on AID. In coming years, we will have many more also. In CGM space, we had changed our time in range concept of time in range between 70 to 180. Then time in tight range is 70 to 140. A new name which has been coined just 1 day before that, if we can call it time in normal glycemia, that thing. And that's new thing which had come. We used to call it TITR. We thought of time in euglycemic range, calling it either TIER or TIYR. But the better word which all experts thought of, that let us call it time in normal glycemia. Why we try to use not in tight range to normal glycemia? Because people should feel that it is something related to the glucose. It is something related to your glycemic control. And that's what the new name had come, the TINC. So this is, I can tell you in short that these are some of the things of ATTD 2025 at this beautiful city of Amsterdam, and see you in Barcelona next year. But before that, don't forget, if it is going in Asian countries, this video, please don't forget to come and attend the ATTD Asia. And those who are from India, want to learn more about different technology which are there in India, come to Jaipur meeting, that is in 9th to 11th May, a World Congress of Diabetes Technology, which we do in India. We have around 500 people. It is a meeting with intensive discussion, lot of debates, lot of learning, lot of sharing, lot of papers which are produced from India, and some of international speakers who will be there with us to connect with them. Thank you.
Absolutely. So that's a lot of takeaway summary of the ATTD 2025 from Dr. Saboo. And folks, stay tuned. Technology is here to transform diabetes management. And for our friends back there in India, we look forward to see you all at DTech in Jaipur in May. Thank you so much.
Thank you.